Hello, my name's Amy Powers, and I'm sending this video from Castro Valley, California. I'd like to express my strong support for Senate Bill 1196, which would expand end-of-life options to include incurable diseases like dementia. Over the past 10 years, I've watched my mom fade away right in front of me. Dementia has taken the spark out of her eyes and out of her life. She's 85 years old and living alone in a memory care facility because her needs are too great for my dad, who's 84, and her loving husband of 56 years. My mom has lived a wonderful life. She performed in the circus in college. She taught children to read for 35 years. She sailed on a boat from California to Panama when she was in retirement. She was once a gourmet cook, a master bridge player, and a skillful pianist. She loved her friends and family until the day she could no longer recognize us. We all miss her so much and hate to see her living a life without joy. I am married with 2 boys. I work a full-time job, and I care for my dad both emotionally and physically, and visit my mom regularly. On top of all this, I'm filled with dread at my own inevitable aging and wonder if I too will get dementia in my 70s. I hate the thought of putting my own family through this, and I want to have more control over how I live my final days. Therefore, I wholeheartedly support Senate Bill 1196. There is no cure for this terrible degenerative disease, just a slow deterioration of the person you once were. This is no way to end an amazing life once lived. Thank you.
Hello, my name is Barbara Riverwoman from Santa Cruz, California, and I'm 86 years old, and I'm thinking a lot about my last days, and especially since my 2 sisters, younger sisters, are both pretty far advanced in terms of dementia. And so the California laws regarding end of life won't cover me if I also miss my window or don't know or don't have the capacity to make a decision. So I really support better exit.
Hi, my name is Bill Piper from Sacramento, California, and I'm in strong support of SB 1196. At age 85, my interest in this issue is long-standing and personal. Following the death of my late wife from cancer in 2010, I was much involved in the successful 2015 effort to pass California's current EOLOA, the End of Life Options Act. Her last days were a horror of needless suffering, and she cried out miserably about not having moved to Oregon to take advantage of their Death with Dignity law. Since then, I've seen the wives of 2 close friends become enveloped in advanced dementia and not be able to avail themselves of California's EOLOA. The same was true for a close male friend who died of ALS. By the time they had reached the currently required 6 months of remaining life, they no longer had the capacity to meet our law's other requirements. The changes proposed in SB 1196 would remedy that defect, while still retaining existing safeguards we know are vital. All terminal patients need a full range of choice in how their life will end, and at the same time ensuring that their choice does not represent mental illness or possible coercion. After almost a decade, no incidents of abuse have arisen under California's EOLA, nor have substantiated abuses arisen during almost 3 decades under Oregon's similar law. Now it's time for our law to address the increasingly common drivers of death and suffering, such as Alzheimer's and ALS, which prevent those very sufferers from having the same range of choice available to all other patients who wish to qualify for medical aid in meeting what is already inevitable.
I am with Jean Fisher from San Diego. Jean, what have you been diagnosed with?
Starting testing about 3 or 4 years ago, they came up with a brain tumor, meningioma, Alzheimer's, and primary progressive aphasia, all with no cure.
Who currently makes your medical decisions?
I do.
Have you ever considered voluntarily stopping eating and drinking?
Oh, yes, because it is the only legal way to end my life. But I don't like it. It is still cruel and mean.
Are you willing to give up a few good days to avoid several bad years?
Yes. To purposely hold a human being in pain for months, for years, is inhumane for me. I just ask that I am accepted for my choice when and how to die, in the same way that I accept the way I accept someone else who wants to end their way of life. I am not given the equal freedom to end my life when and how I want to end my life. My dad had a dementia, and I was the caregiver for about 2 years. It was very painful, not just for me, but for him and other family members. I don't want to go on this path.
Hello. One of the saddest experiences of my life was seeing my 81-year-old mother in excruciating pain from compression osteoporosis. She didn't have a doctor's diagnosis that she had 6 months or less to live, so she couldn't get help in dying even if we could have gotten her to Oregon. Her sad situation motivated me to work on getting California to pass the End of Life Option Act, I believe in 2016. But it wouldn't have helped her because of that 6 months or less expectation to live. But then I had an even more desperate situation when my sweet 84-year-old husband suffered a major frontal lobe stroke a few months ago, which greatly increased his symptoms of dementia. Both of us had filled out an advance directive saying that we don't want our lives sustained if we can no longer take care of ourselves, eat, walk, make decisions, or toilet ourselves. No feeding tubes, ventilators, etc. would just keep us comfortable and help us die peacefully. But since our End of Life Option Act had not been improved, my husband suffered a long, scary decline with frequent falls and traumatic brain injury. In addition to the many losses of ability, going from a university professor to someone who could no longer eat, could not talk understandably, and was very frightened and frequently crying. It was heartbreaking. As a senior, I talked to many others my age who are scared to death of the suffering we see so often among our aging population. Please help us making sure our health system is committed to keeping human beings as comfortable as we keep our pets when they are sick and suffering. We help them die painlessly. Thank you. Go.
Hi, my name is Miriam Coppens. I am 83 and live in Santa Cruz, California. My phone number is 831-332-2183. A few weeks ago, it was determined that I have mild cognitive impairment, 22 on Montreal Cognitive Assessment Scale. I went from shock, deep sadness, and denial. I will be getting further testing, blood, and a referral to the neurology department to figure out what kind of problem I do have. Dementia, Alzheimer's. I will not go the full loss of self. I will not permit the full loss of myself, where I can no longer remember the names of my daughters and grandchildren. I'm determined to find relief through either FEN and or preferably medical aid in dying, but I am not terminally ill. Why is it I need to be terminally ill to get support to die through medical aid in dying? Other legal ways need to be made available, as Better Exit is attempting to do. Please support their work. Thank you.
Hi, my name is Nita Hertel, and I live in Santa Cruz, California. And I want to address my comments to the Health Committee, who's thinking about Senate Bill 1196, which would expand our compassionate approach to end of life. I had a good friend who died from Parkinson's several years ago, and he had a wonderful care team and support from his wife and several friends, and was able to die peacefully. And now his wife, of all unlikely circumstances, has been diagnosed with Parkinson's, and she's been suffering for the last couple of years. And unfortunately, she had to watch her husband die from this disease. And she herself is now facing exactly what he had faced. And she doesn't have the same kind of support. She has a family who has not rallied around her. And she is going to be facing the deterioration that she watched her husband go through without the same kind of support that he had. And she would like to choose to not have to endure this condition to its end. And I totally support people being able to make choices in terms of dementia and other neurological disorders. I urge you to do the humane thing and really step up and show an example that we can change things in a way that will make the world a more kind and humane place. Thank you.
Hello, my name is Richard Goldman. I am a 75-year-old San Franciscan with long-term AIDS and also an anal cancer survivor. The radiation for the anal cancer 34 years ago has caused my pelvic structures to deteriorate, and I now have bowel and rectal prolapse. We call the radiation the gift that keeps on giving. Surgery to correct this dysfunction on radiated tissue, per my surgeons, is likely to fail. And so I quote-unquote live with it. I have pain, incontinence, and limited mobility, and it's getting worse. I also have a newly diagnosed bladder and kidney cancer, and in the last 2 years have had 3 surgeries, and I've declined any further treatment or intervention because, for me, my quality of life is much more important than the quantity, and I have been through enough. And yet I don't have a 6-month terminal diagnosis. Palliative care helps a lot with my symptoms, but my condition is worsening, and it causes much of my life to be miserable and eventually fatal. And while I am not seeking the California End of Life Options Act currently, I can see it as potential somewhere in my future. However, in order for me to access it, I would have to stop my HIV medication, get sicker, to receive a 6-month terminal diagnosis, which seems inhumane and frankly irrational. So thank you, Senator Blake Spear, for authoring this important bill to expand the California End of Life Options Act. It will not only help myself, but many long-term HIV/AIDS people living with complications, as well as many other Californians. Thank you.
Hi, my name is Julie Diamond. I live in Ventura, California. I wanted to send a message of support for SB 1196 to expand end-of-life options for people suffering with serious illness at the end of their lives. My father passed away in 2019. I did watch him suffer through the medical system and treatment that was pretty awful. I think that if he had other options, at least something to consider and talk about, it would have helped. and something that I believe he might have chosen. My mother now has dementia, and since that has started, I've been in a support group for other caregivers with dementia, or caregivers taking care of people with dementia. And there's been a lot of stories that I've heard about the patients pretty much begging for help to get out of, to not have to end their lives that way. Family members in support of it, wishing that they at least had something to consider, options to talk about. And I know it's not for everyone, it's a tough subject, but I think that at least if there was a law that families could consider or patients could consider, that might even make the conversations more palatable for people. And you know, I even think that just having the option available, whether a patient decided to exercise that option, might give them some comfort, you know, to feel less trapped. And ultimately, I think it really should be up to the patient. And I think it's cruel for someone to have to suffer as much as they possibly can to live out the life of a horrible illness as it gets as bad as it could possibly get, which is pretty bad and causes everyone a lot of suffering, not just the patient. And so I really do hope that this SB 1196 is seriously considered, and it would be great if it was passed, at least got on the ballot, for families and for patients. And I appreciate your consideration. Thank you so much. Bye.
Hi, my name is Susan Oppie. I live in Oakland, California, and I've been a registered nurse for 25 years, and I am in support of SB 1196. As a registered nurse, I worked in hospitals, I worked in hospice and palliative care, as well as in long-term care facilities. I've seen a lot of death, and I've seen a lot of suffering. And I believe that expanding this bill of medical aid in dying medication to those who may not meet the criteria as per it is written right now, such as people with dementia, would be such a step in the right direction. In long-term care, families would often come to me and just with great sadness would tell me how the loved one with the dementia would never have wanted to reach this point of poor quality of care, poor quality of life rather, without any sort of joy, without any sort of control. Families would often be very upset about this. And so what this bill would do is allow those people with the dementia who have an idea of what's to come, it would allow them the right to choose a way of not having to go into that scary period of time when they have no more control over their lives, when their quality of life is so poor. But instead, it would allow them to focus on being with people they love, and being within the sacredness of this time of their lives. This is it. This is big, and I feel like our society, we've gotten away from that as far as how we approach death and dying, and how far we've become disconnected from it all. I feel like this law, this bill, would allow people to connect with that, with what's important, with the beauty and the sacredness of that time that they have left, and not dealing with fear and just the anguish that must come along with advancing dementia. And also for the people who cannot administer the medications as is written currently in the law. Those people shouldn't be othered just because they cannot, give the medication as written. So for those reasons and for others, I believe that we need to give dignity to people at the end of their lives and not not cause more stress when the option is there, when a proven option to allow people to die with dignity is present. So I ask that you support this SB 1196 to allow those people who are currently othered out of this system and out of this option, to allow them the right to choose it, and hopefully enter into an end of life and a death period that is much more humane and less stressful. Thank you very much.